It's another wonderful time on your #1 health program, reaching you from the station of excellence, NTA Lagos Channel 10. This week we have lined up topics that, for me, I feel like this particular edition should be dedicated to our women out there, all right? But again, what are the things we're looking at this week? First, we're doing a recap on the importance of breastfeeding. All right, we were able to speak with Dr. Bisola Atere. She'll be letting us into the world of course, the many benefits of breastfeeding, both to the mother and child. And we're able to also put up a public service announcement on family planning. We did this through the major languages, Igbo, Yoruba, Hausa, and of course, Pidgin. And we were also able to interview Dr. Mosumola Dosumu. She'll be telling us all we need to know about menopause. For all the women out there, we know that menopause is a stage that you have to accept it, all right? But I'm sure you don't know the signs and symptoms. So Dr. Mosumola will be telling us all we need to know in terms of the signs and what to expect, and of course how to manage this stage. All of this and more on this week's edition of Health Watch. My name is Nkem or Kibe, and you know how I love to do this with you every week. Let's take the short break. When we return, Health Watch continues in a moment. Stay with us.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
So happy breastfeeding week to everyone, and I would like to commend NTA for hosting such an event back to back and keeping up the same standards of excellence. Breastfeeding confers a lot of advantages to both the mother and the baby. For the baby, there's transfer of the immunity from the mother, so agents that the baby's body has not yet developed yet are transferred from the mother to the child. Also nutrients, vitamins, micronutrients that the child doesn't have access to in the formula is all transferred from the mother to the child. It also facilitates emotional bonding between the mother and the child. It makes the child feel a sense of connection that they also felt in the womb, so that is not also lost. For the mother, it helps with emotional balance with hormonal regulation. So breastfeeding causes hormonal changes in the woman's body, making them a bit more hormonally regulated. It can also aid weight loss, which I know a lot of women go after. So it aids weight loss as well. It helps the tummy go down. It also helps the breast suffer less engorgement due to the frequency of the breastfeeding. So these are just a few benefits that it profers to both the mother and the child. So there are so many factors. Breast milk is liquid gold, so it is undoubtedly the best thing you can give your child first 6 months. Research has even shown that it increases the baby's IQ, right? But there are many reasons. For example, breastfeeding technique. Breastfeeding can be very strenuous for some mothers. You know, a lot of them will complain. They have cracked nipples. They're not getting it right. Baby cannot latch on. So this these things are honestly kind of the biggest factor. So in primary healthcare centers, we make an effort to teach women how to breastfeed properly, the proper technique where you need to put your baby's head and baby needs to latch on. Another thing is time. A lot of mothers don't just have that one newborn. They have like 3 other children at home. They have busy lives. So these also are factors. And we know that people keep breast milk. A lot of women in rural areas especially don't have access to storage to store the breast milk properly that other women may have advantage with. Breast pump again, a lot of women don't have access to that in impoverished regions and all that. So these are just a few factors that can reduce breastfeeding frequency in women. So honestly, I would just say it takes a village to raise a child. Even in medicine, a lot of women, like I said, don't breastfeed because they are not so supported in that. Like it's not their health, physical health is at risk, their mental health is at risk, they have to do things around the house, they have to do a lot of things. So if you find yourself in a woman's life that is breastfeeding, ask her where she needs help. Do you need help washing the bottles? Do you need help me getting this? Do you need help with me looking over your children? Just ask them where they may need help. Even if it's education, ask them what would you like to be educated on? These little questions, taking initiative would encourage them to breastfeed more because it takes a village. So after 6 months, you can continue breastfeeding, but they would ask that you mix in some, recommended formula feeds. You have the NAN 1, you have the NAN 2, and you have the SMA Gold. You have a lot of them. So the only thing that these have is that they have, some nutrients, and then you can already be rest assured that you have given the child the essential things that those formulas don't have in your breast milk. So based off, you've already formed a good foundation. You can now build on it with recommended feeds after that. Then you can also start with little home feeds, but nothing too extreme because you need to take note of the fact that baby does not have the full digestive capabilities that an adult has. So they can't digest the same foods that we can. So I'd like to say well done. Thank you for coming here. Thank you for being present for your child, for giving them the gift of your breast milk, which is underrated because it should be spoken about more. We call it liquid gold. So I'd just like to thank you for being a provider of that. That's all I want to say. I just want to say thank you to the women that are, putting their bodies, that providing their bodies to their child. I just like to say thank you to them. That's all I want to say.
Thank you so much, Dr. Thank you so much, Dr. Bisola Atere. That was a very good one on breastfeeding. And of course, we all know that breastfeeding is a mother's priceless gift to her baby. And I'm sure you heard all the benefits that comes with breastfeeding, both for the mother and the child. Moving on, we have this PSA on family planning. Enjoy it. We'll be right back.
Me, I feel say family planning, it help husband and wife for good health so that at least they can last. And in the other way around, now to allow the woman and the man to have the children that they can be able to train. Because if family planning no there, me, I know people go born not less than 10 dozen.
Family planning na-enyelu di na nwunye aka ka ha dị ime oge ha chọrọ. Family planning na-eme ka nwaanyị ghara ị na-aya ọya ọbụna ma ọya dị iche iche ma ọya ma ụmụ ọya mgbochi.
Family planning tí à ń pè ní ìtẹ̀tẹ̀ ọmọ bíbí ni pé kí àwa àti ọkùnrin àti obìnrin kò yẹ ká bímọ rẹpẹtẹ ju tágbára wọ̀ ní ká lọ tá a bá máa bí bó jẹ́ méjì mẹ́ta ká bí kọ́lọ́ ká tọ́ ọmọ wa nítorí bí gbogbo tá a ṣe rí nsìn nǹkan wọn oúnjẹ wọn bọ̀ tí wọn bá tá a bá bí ká tọ́ kó yanjú kọ́lọ́ kó fún wa bí.
Ya kamata su yi family planning saboda suna rage samun damar 'ya'yansu su ƙara girma kamin su samu wasu 'ya'ya su zo gare su. Idan suna yin family plan za su samu sauƙin abun nan gare su saboda haka ne ake mutane gargaɗin cewa su continue da ko mace wanda yana da mata ya gaya ya yi matan shi ta je ta yi family planning saboda ta samu sauƙin 'ya'ya haihuwa.
Up next is our interview with Dr. Musmola Dosumu on menopause. Yes, I know that this is one topic a lot of women do not want to talk about because, of course, everybody has their own changes and the way they react, the way they respond to the stage, all right? But Dr. Musmola will be telling us all we need to know and how to stay very healthy at this stage. Let's go on that interview. We'll be right back.
There's no particular age, but on average, people reach menopause at the age of between 50 and 51. Reach menopause, not that menopause starts at that age. Most people, on the roadside, you ask them, what is menopause? And they tell you what they understand is when a woman does not see her period. Menopause is beyond that. Menopause starts from when your body system starts to change. Menopause simply means systematic body change. And when this body system is changing, it happens to both men and to women. Most of the time, your body system starts to change from maybe like 38 and above. My body system started to change above when I was 42. But you see, my mom never told me about menopause. I didn't know what to expect about menopause. I didn't know anything about menopause. So when my body system was changing, I started to panic. I didn't have any hand to hold. I didn't have anybody to go to. I couldn't even go to the hospital. I thought maybe I had a form of sickness and disease, and that is what most women out there are going through. But right now, the story is changing. There is a hand to hold. There's a community that you can belong to so that you don't walk on this journey alone. Working on menopause alone can be very stressful. Sometimes it could be medical. Most times it could be medical. Sometimes it's hereditary. When we're talking about normal signs of aging, let's break this down. Menopause has 3 different stages. You have the perimenopause. Well, I'm already 53, and I'm still not in menopause. And then a friend of mine, a much younger friend of mine, she is 47 now. She's in menopause. And she started this menopause journey when she was 38, 37, 38. By 37, she had finished having children. And when she was 38, her period ceased. She didn't even know when her body system started changing. But by 38, her period ceased. And she has not seen her period from 38, and she's 47. This is like more than 10 years ago. But I've seen my period twice this year, which means at 38, she wasn't already in menopause. I'm 53, and I'm not in menopause, but I'm in perimenopause. But you see, when you have an understanding, you should be able to tell yourself that I'm in the perimenopause stage, I'm in the menopause stage, or I'm in post-menopause stage. So it's not really age-related thing. And then when you go through this hormonal imbalance at an earlier age, I've seen younger girls, maybe 24, 30, having issues with their hormones. They need to see the doctor. This can be associated, it could be linked to polycystic ovarian syndrome, anything that has to do with hormone imbalance. Please see your doctor. Your doctor will carry out so many tests and be able to tell you this is not menopause, this is medically related. There are more than, don't get scared, there are more than 64 signs and symptoms. Let me explain this to you. once the estrogen level starts to go down, it affects every tissue, every organ, every system of your body. So every part of you is being affected. The first thing, the most of the time, you notice, well, that wasn't what I noticed when I was going through mine. The first thing I noticed was my mood change, and that was what my children noticed, the mood change. But you see, for most women, what they notice first is their period changing. And that is the perimenopause stage. During the perimenopause stage, you will notice that your period drops from 5 days to 3 days to 2 days. You have to be sensitive enough to know that. Once your body system starts going down, your period starts dwindling like that, you should know that my body system has started to change. Don't panic. What you need to do is to get knowledge. You can get knowledge from the Menno Club. Then secondly, sometimes instead of your period coming down, your period increases. You start seeing your period twice in a week, twice, 2 times in a month, or even 3 times. Or your period goes from 5 days to 10 days to 14 days. That one can be very dangerous. You can't handle it. You can handle the first one, but when it comes to your period going up, because you will be getting tired, you can faint. So many negative medical issues can occur. Please seek a medical attention. Number 1, you must be enhanced with knowledge. Once you're going through menopause or perimenopause, you have to be able to self-assertiveness. Know that this is what I'm going through. Then make fun of it. Make fun out of it. Let the people around you know what you're going through. Let me give you an example. I have 2 wonderful boys. And when we discovered that, okay, mommy's system has started to change, they were the ones that made me realize that I needed help because my mood changed. And then I started going through depression. I made my children understand that this is what I'm going through. I need help. And then once, because they now have an understanding, once I can call my first son, the second son's name, I'll call Richard Ronald, called Ronald Richard, and they'll say, Mom, are you okay? And I tell them menopause things, will laugh over it. Or I get home, I forget things, and they say, Mom, are you okay? Menopause things, and then they get to understand. For husbands and wives, you don't have to cheat on your wife. All you have to understand is, oh, this is what my wife is going through. Oh, she doesn't have feelings for sex anymore, or her mood has changed, she's cranky, okay, she can't help me for breakfast, lunch and dinner. Come on, man, you go to the kitchen and help yourself. If you see that your wife is tired, she's weak, help her. We need support groups at this stage. Without the support group, going through menopause can be very, very dangerous, and it can be lonely. Okay, I will advise every woman, if you're 35 and above, this is the best time for you to get enhanced with knowledge. And then it's good to know that there's some herbal supplements that can help to balance the menopause. Some of these are ginger, turmeric, honey, black pepper. If you blend everything together, add hot water and 5 ml of honey to taste. You take this a cupful in the morning, a cupful at night, you're fine. It helps to balance your hormones. I don't encourage hormone therapy. I don't encourage that because of the side effect of those hormone therapy. But if you take this fresh fruits, take fresh fruit, change your diet, exercise.
And that's when we draw the curtains on this week's edition of Health Watch. You know that I normally say that health conscious people live longer. I know you love to do this with me every week. You love to see my face, and of course the program is very enlightening. All right, but you need to sponsor this program, and you have messages, you have questions, you have inquiries, or there's a topic you would love us to treat. Please send a mail to allkeybeinkem@gmail.com or send a message only to 07060865487. Thank you for being part of this week's edition of the program. See you next week, same time, same station. My name is Nkem Okibe.